PRP needling is a combination of two types of treatment. First of all, we take some blood from the patient's inner elbow. We then place this blood in a centrifuge, and then there is a certain technique to extract that fraction of the patient's blood that contains platelets. And the reason we do that is because platelets are very rich in growth factors. So we extract the section that's richest in growth factors, and then we needle this growth factor solution back into the patient's skin. The needling happens because with the medical needling we create thousands of tiny little punctures in the skin that trick the skin into thinking that there are thousands of wounds to repair. Of course there aren't, because those tiny punctures, they close immediately again, but your skin responds to this trigger with producing more collagen and elastin, remodeling itself, and ultimately remodeling the scarring as well. While we are doing the needling, we use the growth factor solution that comes from the patient's own blood. So it's a very, very natural solution, and we needle it into the skin while we're doing the procedure. So that further boosts the collagen and elastin production in the skin, and you will ultimately get better results and a better outcome. As an alternative to using PRP, we may use Exokine. Exokine is a similar growth factor rich solution that we get from the patient's blood, but the difference is that after taking the blood, we put the blood into an incubator. So there the blood is heated for 6 hours, and that stresses the cells. And the response of these cells is that they produce much more growth factors. So we then spin the blood down after 6 hours. We harvest the growth factors not only from platelets, but from all sorts of cells in the blood. So that's including the white cells and the red cells and the platelets. And we then filter out all of those cells, so we've got a solution that's very, very high in growth factors without anything else in it.